Creatine is a natural substance found in your muscles and also in small amounts in foods like meat and fish. It helps your body make quick energy, especially during short bursts of activity like lifting or sprinting. Robust evidence clearly demonstrates the importance of creatine on cognitive function comes from individuals with creatine deficient syndromes, known to deplete brain creatine stores. But in recent years, people have started asking, can creatine help with diabetes too? Or does it cause problems? Now let's talk about creatine and how it works in the body. Creatine helps your muscles produce energy quickly by supporting a system called ATP. I take 5 grams daily for better brain function and muscle function. But you do not need to understand the science deeply. Just know it helps your muscles perform better. Many people take creatine as a supplement, especially those who go to the gym. A typical dose is around 3 to 5 grams per day, which is considered safe for most healthy adults. But when someone has diabetes, the question becomes more important and more serious. Some people worry that creatine might increase blood sugar levels. Others think it may actually improve how the body uses sugar. But the truth is more balanced and depends on how it is used and who is using it. Research shows that creatine does not directly raise blood sugar levels in most people. In fact, some research suggests it may help improve insulin sensitivity by around 10 to 20%. But this benefit is often seen when creatine is combined with regular exercise. Exercise itself is one of the most powerful ways to manage diabetes. It helps your muscles use more glucose, lowering blood sugar naturally. But when creatine is added, it may boost this effect even further in some cases. One research trial looked at people with type 2 diabetes who exercised regularly. Those who took creatine along with exercise showed better blood sugar control than those who did not. But the improvement was moderate, not a miracle change. For example, some participants saw their HbA1c drop by about 0.5% over a few months. This may sound small, but even a 0.5% drop can reduce the risk of complications significantly. But it is still not a replacement for medication or proper medical care. Creatine may also help increase muscle mass over time. More muscle means your body can store and use more glucose efficiently, but this effect takes time and depends on consistent exercise and proper diet. Another interesting point is how creatine affects glucose transporters in the body. These are like doors that let sugar move from blood into muscle cells. But creatine may help open more of these doors, especially after exercise. Some research suggests an increase in a transporter called GLUT4. This can improve how your body handles sugar after meals. But again, these benefits are stronger when combined with physical activity. Now let's talk about safety, because that is very important. For most healthy people, creatine is considered safe when taken in recommended doses. But people with diabetes need to be more careful, especially if they have kidney issues. Diabetes can sometimes affect the kidneys over time. Around 30 to 40% of people with diabetes may develop some level of kidney damage. But since creatine is processed through the kidneys, this becomes an important concern. Some people think creatine damages the kidneys, but this is not true in healthy individuals. Research over many years has shown no harmful effect on kidney function in healthy users. But in people with existing kidney problems, caution is always advised. If you have chronic kidney disease or any other kidney issues, you must talk with your kidney doctor before starting creatine and take an initial reading of eGFR, which is a simple kidney function test. Creatine can artificially elevate creatinine levels, making wrong eGFR readings and may pose risks to pre-existing renal conditions. If there is any sign of kidney disease, it is better to avoid or consult a doctor. This is not something to guess or experiment with on your own. Another concern is water retention and dehydration. Creatine pulls water into muscle cells, which may increase body weight slightly. but this is usually around 1 to 2 kilograms, mostly water weight, not fat. For people with diabetes, staying hydrated is very important. High blood sugar can already lead to dehydration, but adding creatine means you need to drink even more water to stay balanced. There is also the question of weight gain. Some people worry that creatine will make them gain unhealthy weight, but most of the weight gain is from water and muscle, not fat. In fact, building muscle can help improve metabolic health. More muscle can mean better control of blood sugar over time, but this only happens when combined with proper exercise and nutrition. Now let's look at people with type 1 diabetes. There is less research available compared to type 2 diabetes, but early findings suggest creatine does not significantly harm blood sugar control. Still, type 1 diabetes requires careful insulin management. Any supplement that changes energy use can affect insulin needs, but the changes are usually small and manageable with proper monitoring. People using insulin should always check their blood sugar regularly. If creatine is added, they should watch for any unexpected changes, but most reports show stable or slightly improved control, not worsening. Another area of interest is fatigue and energy levels. People with diabetes often feel tired due to fluctuating blood sugar levels, but creatine may help improve energy during physical activity. This can encourage people to exercise more regularly, and regular exercise is one of the strongest tools for managing diabetes. But motivation and energy are often barriers, so this small boost can help. Some research also suggests creatine may support brain health. Diabetes is linked with a higher risk of cognitive decline over time, but creatine may help support brain energy and mental performance. This is still an emerging area, and more research is needed, but the early signs are promising and worth paying attention to. But again, it is not a treatment, just a possible support. Now let's talk about dosage and usage. Most experts suggest a simple daily dose of 3 to 5 grams, but there is no need for high-loading doses, especially for beginners. Taking creatine with a meal may help better absorption. Some people prefer taking it after exercise for added benefit, but the timing is less important than consistency. It is also important to choose a good quality supplement. Look for pure creatine monohydrate, which is the most researched form, but avoid products with too many added ingredients or sugars. Sugar-added supplements can raise blood glucose levels. This defeats the purpose for someone managing diabetes. But pure creatine has no sugar and no calories. Now, let's clear one common myth. Creatine is not a steroid and does not affect hormones in that way. But many people still confuse it with unsafe substances. Creatine is one of the most researched supplements in the world. Hundreds of research papers over the past 30 years support its safety. But like anything, it must be used wisely and in the right context. So where does that leave us? Creatine may offer small benefits for people with diabetes, especially when combined with exercise. But it is not a cure and not a replacement for medication or healthy lifestyle. It may improve insulin sensitivity by around 10 to 20% in some cases. It may help lower HbA1c slightly, around 0.5% in certain individuals. But these numbers vary from person to person. Safety depends largely on kidney health and proper hydration. If kidneys are healthy, creatine is generally safe in recommended doses. But if there are complications, medical advice is necessary. The biggest benefit may come from improved exercise performance. Better workouts can lead to better blood sugar control over time. But this requires consistency, not occasional effort. So the real question is not just about creatine alone. It is about how it fits into your overall lifestyle. But supplements work best when the basics are already in place. Healthy eating, regular movement, good sleep, and proper medication. These are still the foundation of managing diabetes. But creatine can be a small supporting tool for some people. If you are thinking about using creatine, start simple and observe your body. Check your blood sugar regularly and stay hydrated throughout the day. But most importantly, talk to your doctor before starting. While we are in the middle of the video, if you think this video is useful, click the like button and subscribe to my channel. It is a simple help to me encourage to make more videos.